So today we are going to see our chapter gingiva. In that, microscopic and macroscopic features we are seeing. In macroscopic structure we are seeing marginal gingiva, attached gingiva and mucosal gingiva.
It is the part of oral mucosa that covers the alveolar process and surrounds the neck of the tooth. This is neck of the tooth and gingiva. This is gingiva. According to their position, gingiva can be classified into three parts: free or marginal gingiva, attached gingiva, and the interdental gingiva we can see in the next slide. So the marginal gingiva, it is also known as unattached or free gingiva. It is a terminal edge or border of the gingiva that surround the tooth in collar-like fashion.
In marginal gingiva is also known as unattached or free gingiva. This is the marginal gingiva. Here the unattached portion we can see, therefore it is also known as unattached or free gingiva. The terminal edge or border of gingiva that surround the crown in collar-like fashion. It is like this. In 50% cases there is shallow linear depression called gingival groove. Here you can see this is the shallow groove. It is also known as free gingival groove. It demarcates the adjacent gingiva by shallow linear depression. Marginal gingiva is about 1 mm wide. The most apical point of marginal gingiva, scalloped, is called as gingival zenith. This scalloped gingiva is also known as gingival zenith. Now the gingival sulcus. Gingival sulcus is the shallow crevice or space around the tooth. Here some space we can see. That space is known as gingival sulcus, that shallow crevice or space around the tooth. One side is bounded by the free gingiva and other side is bounded by the tooth surface. Its normal or ideal depth is 0 mm, but during its histological section it is reported as 1.8 mm, and during its probing, when we inserting the probe, this probing depth is clinically normal gingiva having 2 to 3 mm. Attached gingiva. Attached gingiva is continue with the marginal gingiva. It is firm, resilient and tightly bound to the underlying periosteum. This is the attached gingiva. Continues with the free marginal gingiva and attaches to the alveolar bone. The facial aspect. This is the facial aspect. It attaches the alveolar mucosa where it forms a junction, that is mucogingival junction. The distance between mucogingival junction and the external surface or bottom of the gingival sulcus, that is known as attached gingiva depth or the length. So to measure attached gingiva, V minus mucogingival junction minus sulcular depth. So width of attached gingiva is varies between anterior to posterior. So it is greatest in the incisor, 3.5 to 4.5 on the mm on the maxilla and 3.3 to 3.9 mm in the mandibular region. It is narrower in posterior segment, 1.9 mm in maxillary first premolar and 1.8 mm in mandibular first premolar. Because the mucogingival junction remains stationary throughout the adult life, it changes in the width of attached gingiva are caused by modification in the positioning of coronal portion. जैसे coronal portion हिलेगा, वैसे gingival junction की जगह बदलेगी, नहीं तो वो stable रहता है throughout the adult life. The width of attached gingiva increased by the age of 4 years. 4 साल के बाद attached gingiva की width increase होना चालू होता है. So in the interdental gingiva occupies the gingival embraces. This is the embraces, which is interproximal space beneath the area of tooth contact के नीचे का part. It is pyramidal or have the coal shape. This is pyramid like have coal shape. A valley depression that connect the facial and lingual papilla and confirm the shape of interproximal contact. यहाँ पे हम देखेंगे अगर अंदर से और बाहर से ये फेशियल साइड और अंदर से लिंगुअल साइड यहाँ पे कनेक्ट होती है. The lateral border on tip of interdental papilla are formed by the marginal gingiva of adjoining tooth. यहाँ पर ये मार्जिनल जिंजाइवा होती है, इधर दिखती है ये फेशियली और लिंगुअली अटैच होती है इधर, और यहाँ पर इंटरडेंटल जिंजाइवा फॉर्म होता है. पेशेंट में डायस्टेमा होता है तो जिंजाइवा इज फर्मली बाउंड ओवर द इंटरडेंटल बोन. वो उस स्पेस के ऊपर से जिंजाइवा कनेक्ट होता है. फर्स्ट वी विल सी द ओरिजिनल स्ट्रक्चर in our oral cavity of gingiva, that this is the attached gingiva extended. उसके बीच में होता है इंटरडेंटल जिंजाइवा और इधर ये फ्री जिंजाइवल ग्रूव. इधर हमें आगे जाके म्यूकोजिंजाइवल जंक्शन भी दिखता है और वो एल्वियोलार म्यूकोसा से अटैच होता है. So now we will go towards the microscopic structures of gingiva. Microscopic structures of gingiva consist of epithelium, basement membrane, connective tissue. First we are going to see epithelium. In that the lining of epithelium, functions, cells present and their types we can see. So the gingival epithelium, it is present to provide only a physical barrier to infection or underlying gingival attachments. Gingival epithelium consists of a continuous layer of stratified squamous epithelium. This is the continuous layer of stratified squamous epithelium. There are three zone areas that can be defined from the morphologic and functional point of view: the oral outer epithelium, the sulcular epithelium, and the junctional epithelium. So in the epithelium, it can be keratinized, parakeratinized or non-keratinized. Keratinized epithelium, the complete keratinization process leads to orthokeratinized structure where no nuclei in the stratum corneum and a well-defined stratum granulosum is seen. In the stratum corneum we do not see any nuclei. This is orthokeratinized. And this is non-keratinized, in which the superficial layer, there is neither a granulosum or corneum strata is present, where superficial cells have visible nuclei. It do not have two layers, that granulosum and corneum. It is non-keratinized epithelium. The major cell type in the gingival epithelium is known as keratinocyte. That keratinocyte undergoes proliferation, takes place by mitosis in basal layer. It does proliferation along with the differentiation also, involving the keratinization, according to which the keratin is formed. With keratinocyte, epithelium also consists of non-keratinocytes, which include Langerhans cells, Merkel cells, melanocytes. Langerhans cells do the defense mechanism. Merkel cells do the tactile percussions used for the sensation purpose, and the melanocytes, as we know, produces pigmentation. Gingival epithelium, the cell attachment is done by the desmosomes, adheres junctions. Well, these cells are attached by desmosomal attachment, where the cell attachment is by desmosomes. Like that, the cell attached to the basal lamella, that is known as hemidesmosomes, where the desmosome consists of a typical structure consisting two dense attachment plaques into which tonofilaments inserted and intermediate. The uppermost part of spinosum, this part, consists of numerous dense granules, that is keratinocytes or woodland bodies. ये keratinocytes और woodland bodies एसिड फॉस्फेट कंटेनिंग होते हैं. These are modified lysosomes and these are acid phosphate containing, which is helpful for destruction of organelle membrane which are suddenly occurs between granulosum and corneum strata. And melanocytes and dendritic cells located in basal and spinosum layer of gingival epithelium, they synthesize melanin in organelle called premelanosomes and or melanosomes. Now, the Langerhans cells and dendritic cells located among keratinocytes at all suprabasal layers. In this layer, where the rete ridges are present, the Langerhans cells are present, doing the activity like phagocytosis. It have important role in the immune reaction as antigen presenting cells for lymphocytes. Then the Merkel cells are located in deeper layer of epithelium. They harbor nerve endings and they are connected to adjacent cell by desmosomes. They have been identified as tactile perceptors. Now we will see about the epithelium according to their types. Outer epithelium. Outer epithelium covers the crust of outer surface of marginal gingiva and the surface of attached gingiva. Here the outer epithelium is present. It has its thickness 0.2 to 0.3 mm. It is keratinized or parakeratinized. Epithelium. Circular epithelium lines the gingival sulcus. It is non-keratinized and stratified squamous epithelium without rete-pegs. Rete-pegs means the insertion of basal layer into the connective tissue. So it do not have those rete-pegs. So as the non-keratinized epithelium is present, the sulcular epithelium lacks granulosum and corneum strata. The sulcular epithelium is extremely important. It may act as a semi-permeable membrane through which injurious bacteria product passes into the gingiva and through which tissue fluid from gingiva spin into the sulcus. Like the junctional epithelium, however, the sulcular epithelium is not heavily infiltrated by polymorphonuclear neutrophils, leukocytes, and it appears to be less permeable. Sulcular epithelium may be affect our health by it is injurious. Injurious bacteria also can enters from this. So it is extremely important. Now, the junctional epithelium. The junctional epithelium consists of collar-like band of stratified squamous non-keratinized epithelium. इसमें collar-like band होते हैं of stratified squamous non-keratinized epithelium. उसमें junctional epithelium varies in the layer number according to age. It is 3 to 4 layers thick in early life. After it is increasing with age, and 10 or even 20 layers can be present later. Epithelium tapers from its coronal end to the apical end, where 10 to 29 cells wide are present at coronal end and 1 to 2 cells wide at apical termination. It is located at the cemento-enamel junction, the healthy tissue. The length of junctional epithelium ranges from 0.25 to 1.35 mm. So in the connective tissue, this is the alveolar bone, this is the gingiva, this is the non-keratinized, this is keratinized part, and this is the connective tissue. The major connective tissue of gingival connective tissue of collagen fibers, fibroblasts, vessels, nerves, and matrix are present. The connective tissue of gingiva is known as lamina propria. It consists of two layers: papillary layer subjacent to the epithelium that consists of papillary projections, and the epithelial retapex, a reticular layer that is continuous with the periosteum of the alveolar bone. So this is the papillary layer containing these projections, and this is the reticular layer where the periosteum of alveolar bone is continuous. But gingival fibers, we can see here also, these are the fibers. According to their position, they are named as dentogingival fibers, circular fibers, transseptal fibers, and transgeminal fibers. We will see now. We will see the macroscopic diagram of the gingival fibers. The connective tissue of marginal gingiva is densely collagenous. It contains the prominent system of collagen fiber bundle that are known as gingival fibers. Gingival fibers is very important question for our both BDS and MDS students. So gingival fiber means the connective tissue of the marginal gingiva that densely collagenous and containing a prominent system of collagen bundles. The fibers consist of type 1 collagen. Uses of gingival fibers: to brace the marginal gingiva firmly against the tooth, to provide the rigidity necessary to withstand the masticatory forces without deflecting away from the tooth, to unite the free marginal gingiva and the cementum of the root and the adjacent attached gingiva. ये marginal gingiva को tooth के साथ attached रखता है, provide rigidity and withstand forces of mastication, और free marginal gingiva को अटैच gingiva के साथ अटैच्ड रखता है थ्रू दी cementum. विद द cementum को भी अटैच करता है. Now we will see the three groups of gingival fibers: gingivo-dental, circular, and transseptal. Gingivo-dental fibers, these are on the facial, lingual, and interproximal surfaces, embedded in the cementum just beneath the epithelium at the base of gingival sulcus. Here we can draw. These are the gingivo-dental fibers connecting cementum to gingiva. Extend from the cementum. This is crust of the gingiva. This is on the outer surface. External to periosteum on labial part. This is the external to periosteum of the labial palate. Circular fibers are also shown in between. So the gingival fibers, they project from the cementum in a fan-like configuration. This is fan-like configuration towards the crust and outer surface of marginal gingiva. They also extend externally to the periosteum, extend toward the crust of interdental gingiva. Now the circular fibers course through the connective tissue of the marginal and interdental gingiva and enclose the tooth in a ring-like fashion. This is the circular fibers. Now the transseptal fibers, which are located interproximally from horizontal bundle that extend between the cementum of the approximating teeth into which they are embedded. This is another tooth. Now these are transmitting. This is known as transseptal fibers, which transfers from tooth one septal to another septal. The blood supply, lymphatics and nerves present in the gingiva. The microcirculatory tracts, blood vessels and lymphatic vessels play an important role in the drainage of tissue fluid and in the spread of inflammation. There are three sources of blood supply to the gingiva are present. Supraperiosteal arteries, which are present beneath tooth towards the periosteal. Supraperiosteal arteries, vessels of periodontal ligament, and the arterioles. Now we will see the correlation of clinical and microscopic feature. Understanding the normal clinical feature of the gingiva. Seeing color. The color of attached and marginal gingiva is generally color pink, produced by vascular supply, thickness of and degree of keratinization of epithelium and the presence of pigment containing cells. It is lighter in blonde individual with fair complexion than in swarthy, dark hairy individuals. Attached gingiva demarcate the adjacent alveolar mucosa of buccal aspect by a clearing defined mucogingival line. Here we can see this mucogingival line identified by its color. The alveolar mucosa is red, smooth and shiny rather than pink and stipple. This is red mucogingival junction. The epithelium of alveolar mucosa is thinner, non-keratinized, and it contains no retapex. The connective tissue of alveolar mucosa is loosely arranged and the blood vessels are more numerous. This is stippled lining. In this diagram we can see this shows the normal gingival appearance, and this is we can see this containing periodontal disease. See the physiologic pigmentation, that is melanin formation. Melanin is responsible for the normal pigmentation of gingiva. Melanin is present in all normal individuals. Its pigmentation in oral cavity is prominent in black individuals. Ascorbic acid directly downregulated melanin pigmentation in gingival tissue. Size of the gingiva. Size of gingiva corresponds with the sum total of the bulk of cellular and intercellular element and their vascular supply. This is the element and we can measure it by the cellular, intercellular elements and vascular supply. Contour. The contour or shape of gingiva varies considerably and depend on the shape of the teeth and their alignment in the arch, the location of size of the area of proximal contact, and the dimension of the facial and lingual gingival embrasures. On the tooth, contour is dependent, like this. Now we will see the shape. Shape of interdental gingiva is governed by the contour of proximal tooth surface and the location of the shape of gingival embrasures. This embrasures shape and as it is the gingival shape. Now the consistency. The gingiva is firm and resilient and with the exception of the movable free margin tightly bound to the underlying bone. The surface texture. The gingiva present a texture surface similar to that of the orange peel is referred to as stippled. Stippling means a gingiva presents a texture surface similar to orange peel. ऑरेंज पील की तरह उसका अपीयरेंस होता है इधर, ये देखते हैं, इसको हम स्टिपलिंग बोलते हैं. इट इज़ अनदर इम्पॉर्टेंट क्वेश्चन इन आवर एग्जाम्स. द अटैच्ड gingiva is stippled, the marginal gingiva is not. The central portion of interdental papilla is usually stippled, but the marginal border are smooth. See, stippling is less prominent on lingual than facial surface and may be present in same person. Microscopically, stippling is produced by alternate rounded protuberance and depression of gingival surface. The position of gingiva is the level at which the gingival margin is attached to the tooth.